always will be a risk. That doesn't mean you don't bring it up. You need to deal with it. If you ignore it, you're definitely going to have problems. Second mistake often the therapists make is that you forget to monitor the quality of responsiveness. Responsiveness of the patient towards the therapy, responsiveness of the therapist also towards the therapy, right? And remember, it's not that the first time, again, like I said, एक बार आपको बन गया doesn't mean जिंदगी भर बना रहेगा. कभी भी rupture हो सकता है. You need to be constantly monitoring yourself and the patient, which means there's a lot of thought that needs to go in for each session, even after each session is done, even during the session. So it's a lot of tiring work. In the session, you need to be having all your senses up there. Actively listening, you're following all those 13 techniques, you're also saying what to say, what not to say, and you're monitoring all the responsiveness, relatedness of the patient as well as yourself. But also remember, as clinicians, we will make mistakes. All these mistakes have to be viewed as a learning opportunity and use each mistake within the therapy. So I always, whenever I identify a mistake, sometimes it works, sometimes it doesn't, but I always bring up whatever I have identified within my session. Why let it go? Bring it up, meta communicate about it. Let's try together to understand why they happened, how they happened, who contributed how much to that mistake, if at all, and what was our experience of that mistake so that we can end up working through it and not just brushing it under the carpet. Okay. Last most important factors, which are the crucial, very, very crucial parts of a therapeutic alliance or the relationship. Like I was talking about, boundaries. Boundaries, like you have a physical boundary outside a house, you have to have actual psychological boundaries between the patient and the therapist. There has to be psychological boundaries across the entire therapeutic space and the entire world. So you need to understand that the relationship between the patient and the therapist is very intimate in nature. The conversations that you all are having, the patient is unable to have with anybody else, and of the nature that you're having them. The kind of professional relationship and yet so personal, it's a unique relationship, right? Both of you are committed to healing, but you need to make sure that there is no abuse happening. Abuse even emotionally, even psychologically of either one of you, right? So boundaries are basic expectations which you need to decide in advance. You need to talk about them, you need to discuss them, you need to agree upon them in the beginning, and they need to be accepted by the patient and the therapist. What is my appropriate behavior? What is the patient's appropriate behavior? So even let's say in this internship right now, when so many of you message me that I'm managing 8,000 interns, so when I am telling you just now in the beginning of the session that I will not be able to respond to SMSs, or let's say I said I will not be able to respond to any messages beyond 7 p.m., or I won't be able to take repetitive calls. What is that? I am setting my boundary right now. Rather than you keep calling me and I don't take your call, I have realized that's something that I cannot commit to. So I'm letting you know. So you don't keep calling me, and I'm letting you know that you don't end up feeling bad if I didn't take your call because I've told you not beyond 7 p.m. That's a boundary that I've set. So if I have to talk about some boundaries that I've set with my patients, and I'm not saying there's a rule book to this. So for example, I do not respond to WhatsApps of my patients. I tell them please SMS, because for me, WhatsApp is a personal space. SMS is a professional boundary where you still have a limit on the characters that you can SMS. So you'll talk only about what needs to be said. If you need to get in touch with me, don't just call me. I'm available for my patients in emergency. Drop me a text with your name. Drop me a text with that is an emergency. And as soon as I have the time, I will definitely get back to you. And I do, right? But that is something that I have decided as a boundary, as something that I have talked and communicated to the patient, not just in my head, right? Second and crucial aspect of any therapeutic relationship is confidentiality. It's a major ethic to remember, to keep in mind that the patient's privacy has to be protected, respected, and maintained. So yesterday and day before, when you talked about all those notes with Ila ma'am, that you're taking notes of the patients, all those for day one assignments that you people made. Some of you actually ended up recording a session. Some of you just sent a transcribe. I did have a look at some of them, but I'm not going to be able to review them right now in any case. So all of that, you need to make sure, and this was a role play of course, but in case you're actually working with the patient, what do you do with those personal details? Why have we stopped you from putting it on Instagram? Because you're sharing somebody's details, how much ever you might disclose the name. that personal detail needs to be respected, right? And that can only happen with trust and respect, which is mutually there. The patient should be able to trust you, and you should be able to trust the patient also. Can there be exceptions to this rule? Yes. What are those exceptions? Let's say it's a child under 18. Again, you need to talk in advance, set aside certain guidelines with the patient and the parent in advance so that they both are aware in what situations, how much will you be briefing the parents, how often will you be briefing them, will you be briefing them at all or not, how do you work as a therapist. You need to set these rules down. Same way, sometimes if you're working in an organization, we might have some supervision groups happening. Let's say you'll be talking to your peers about a particular case. Even in that, you need to make sure that there is a professional purpose that is being maintained. Charger, please. Charger. Now, in exceptional circumstances, also when there is a threat of harm to self or others. For example, if it's a potentially suicidal case. Let's say if there is a time where the patient might be homicidal also, which means he might be potentially getting aggressive or wanting to harm somebody else in their aggression. Okay, then even in these situations where it is because of being underage, if it is because of a potential risk of harm to self or others, in all those cases, what we need to remember is that we need to talk about this in advance. If this happens, this is when I will be breaching confidentiality, and this should be talked about in the beginning and agreed upon. Like you agree about the boundaries, same way you have to agree about the basic confidentiality ethics. And you will tell them, let's say there is a person who's saying, I'm going to go and commit a murder. If the person has disclosed that to you, you need to have talked about this in advance, that if a potential risk of harm to others comes, I will be responsible to report this, right? And I will be very open and honest with the patient also. So sometimes I'll take permission from the patient, sometimes I will inform the patient if he or she is not okay with me. Even if it's a child, you need to again let them know that there are going to be some things that I will need to go back and report to your parents. So these things are talked about. Yes, very tricky, very challenging. I'm sure there are going to be some questions coming up in this area. There is no one right answer to them, and we're still waiting in India to have a set of clear-cut guidelines. I think having insurance for mental health, which came up in the past few years, is helping in some kind of documentation to start. So we need a few more years, but we will get there where we'll have a guideline given to us. But even then, there will be loopholes. There will be times where you need to use your clinical judgment to decide. Towards the end, how do you end one session itself? Very, very important, because sometimes it's a 1 hour session and for 45 minutes it's just been the patient speaking back and forth. You don't know now how to end. And if you don't terminate that session skillfully, if you don't let the patient go back feeling slightly more positive, he or she will not come back. You can't say, I'm going to spend the first 5 sessions just listening to you and understanding what's going on, and after that I will try and get into giving you some. There is some kind of hope, there's something that the patient needs to be able to take away. And that is possible not because you're going to give them some magical advice in the first session. Maybe not possible, right? But you can follow the simple 13 techniques that we talked about. That is enough to help the person form a rapport. And if the person takes back a rapport, that means the person is taking back positivity from that experience of the first session. Towards the end, there might be a lot of emotions that the person experiences, a lot of anxiety. I don't know what I said. I don't know what I shouldn't have said. I don't know what all has come up. A lot of things haven't been discussed. We need to make sure that you give a sense of continuity left, that just because this session is ending doesn't mean we're going to lose out on whatever has been left behind. But I think a number of things we have to discuss in our next session. I believe today we've gained some insight into why you get up in the middle of the night every day. Perhaps in the next session, we can explore this further. So that there will be a next session where we will talk about this. And the last part is actually terminating the entire therapeutic process. Not an easy thing to do, definitely, for both the therapist and for the patient. Sometimes you don't know when it's time also. It can be challenging. So this is something you need to talk about in the beginning. Sometimes people give a set number of sessions you're going to have, more or less. Sometimes you can decide, let's say it's a timeline that the person is here and is going to college after these many months. So you have these many months for therapy. Sometimes it could be once you are able to achieve this goal that you are able to go and have a social interaction independently without any breakdown for let's say 2 months at a stretch. That is a goal that you achieve. Then you can start working towards a termination, for example. So talk about this in advance. Clarify this in the very beginning itself so that we know how to approach ending the entire counseling process. Some tips that you can keep in mind are review whatever has gone well. There's something that has been achieved, some goals that have been achieved during the counseling process. Review them, summarize them. There would be a lot of feelings of loss that would come up that, oh my God, there's this 1 hour every week that I used to spend with you that is now not going to be there. There will be a vacuum, right? Because there's a lot of relationship, there's a lot of investment, emotional, physical, financial, that has gone into building this therapeutic relationship for how many ever months or sessions that you have. So allow them to talk about the feelings that they are going through. If there are any goals that have been accomplished, you've talked about them. Also talk about the goals that you were not able to accomplish. Aftercare plan is the relapse prevention. In case some symptoms still comes up in the future, what will you do post therapy to try and prevent that, to try and deal and respond with that? Okay. Remember, the timing of a termination of therapy is very, very important. Needs to be planned, needs to be done with lots of sensitivity, needs to be done with a lot of care. It cannot be too early, it cannot be too late. Too late means there's a lot of dependency that's formed, which means every time there's a crisis in the patient's life, they're going to be reaching out to the therapist. Not okay for lifelong, you're not going to be there to lead the patient's life for them. And if happens too early means the patient is not ready to be able to deal with crisis on his or her own. So balancing that out and making sure the timing is correct is very, very important. So that is it for today's session. These are some of the readings